Well, if you are a likely candidate for hip replacement, you'll want to hear what these experts have to say to our Courtney Corbetta as they join her from Catholic Health.
Are you someone that struggles with hip pain? Maybe you've contemplated surgery, but you're unsure of where to go or who to turn to. Well, this morning we take a trip to Lewiston, and we're here at Mount St. Mary's Hospital catching up with Dr. Kafai Lai and a physical therapist, Kristen Bernard. Thank you so much to the two of you. Good morning.
Good morning. Thank you.
Well, Dr. Lai, I'm going to start with you. If someone at home is suffering with hip pain, what type of discomfort are they experiencing?
Well, typically, patients with hip pain, they have pain in the groin, and with hip pain, it's usually activity related. So the more you do, then the more you experience the pain. Occasionally, hip pain can also be from the side of the hip, from the buttock area, and that's basically where one will feel the discomfort.
If someone is experiencing discomfort, when should they seek treatment?
We usually recommend activity modification first, and if they try Tylenol or other forms of anti-inflammatories. But if the pain is persistent and if they are at all concerned, then we're more than happy to take a look at their hip.
Kristen, doctors usually prescribe physical therapy as treatment. What does that involve?
Well, when you go to physical therapy, you refer to physical therapy. The physical therapist is going to do an evaluation, and they're going to determine what structures might be causing that patient pain or limitation. And then they're going to base an exercise program, usually stretching and strengthening, to help that patient overcome that, as well as hands-on manual techniques where the therapist can help that patient mobilize that area and release tight tissues. Well, something unique to St. Mary's is we offer a prehabilitation program to patients that are going to be having a hip or joint replacement, and that gives them an opportunity to get back up and moving and get some strength and some endurance back in them before they have the surgery. Also educate the patient so they know what to expect during the surgery and rehab process.
Once a patient has received physical therapy, when is it time to consider hip replacement surgery?
Well, first of all, we have to confirm the diagnosis, so that involves a detailed clinical examination, physical examination, reviewing of the radiographic images, as well as looking into what sorts of conservative management they've tried, for example, medications, any physical therapy treatments, and ultimately our role is to educate the patient, provide them with information, and what we're looking into is, once we confirm the diagnosis, how much is the pain, is the condition bothering them? If it's affecting their daily function, for example, they can no longer walk as much as they like, if it's really affecting their quality of life, then that's when we consider a total hip replacement.
Well, Dr. Lai, talk to us about some of the options that you provide.
There are different ways of doing a total hip replacement, and first of all, what I'd like to say is that total hip replacements are very successful surgeries, and majority of the time it helps alleviate the pain and also improve function.
Kristen, where can our viewers go for more information on this type of surgery?
Well, you can visit the Catholic Health website, or Dr. Lai and I are going to be speaking at the 4 Point Sheraton, Niagara Falls, and we're going to have a dinner complimentary if you want to join us, and that's January 29th.
So this is an opportunity for Western New Yorkers to come out, meet the two of you, and learn about all the different options that can help them live a happier and healthier life.
Absolutely, and they're welcome to ask questions. There'll be a breakout session at the end.
All right, thank you so much, the two of you. Thank you for having us here at Mount St. Mary's Hospital in Lewiston. If you are a loved one or contemplating hip surgery, this is the place to be. Contact Catholic Health.